Pregnancy ends with one of the most remarkable processes in human biology, labor and birth. Labor is the coordinated work of hormones, muscles, nerves, and the pelvis. Each system plays a role in guiding the baby from the uterus into the outside world. The process usually begins when hormonal signals prepare the uterus for contractions. Two important hormones are oxytocin and prostaglandins. These chemical messengers bind to receptors in the uterine muscle. They trigger rhythmic tightening of the myometrium, the powerful muscle layer of the uterus. At first, contractions may be mild and irregular. Over time, they become stronger and more organized. With each contraction, the upper uterus tightens and shortens. This pressure gently pushes the baby downward toward the cervix. The cervix is the lower opening of the uterus that connects to the birth canal. Before labor begins, the cervix is thick, firm, and closed. During early labor, it begins to soften and thin. This thinning process is called effacement. As contractions continue, the cervix gradually begins to open. This opening is called dilation. Dilation occurs slowly at first. In early labor, the cervix may open only a few centimeters. As contractions strengthen, dilation accelerates. Eventually, the cervix must open to about 10 centimeters to allow the baby to pass through. At the same time, the baby begins to move deeper into the pelvis. Inside the uterus, the baby is surrounded by the amniotic sac, a protective fluid-filled membrane. Sometimes during labor, this membrane ruptures. When this happens, amniotic fluid flows out through the birth canal. This event is commonly called the water breaking. Once the cervix is fully dilated, the next stage of labor begins. With each contraction, the uterus pushes the baby downward into the pelvic cavity. The baby's head usually enters first. The pelvis forms a curved pathway. To pass through it, the baby must rotate and adjust position. As the head descends, it turns slightly to align with the widest dimensions of the pelvis. This movement is known as internal rotation. Gradually, the baby's head reaches the lowest part of the birth canal. At this point, the top of the baby's head begins to appear at the vaginal opening. This stage is called crowning. During crowning, the surrounding tissues stretch to allow the baby to pass safely. With the next strong contractions, the head moves fully through the birth canal. Once the head is delivered, the shoulders rotate to align with the pelvic outlet. The upper shoulder emerges first, followed by the lower shoulder. Soon after, the rest of the baby's body follows smoothly. At this moment, the baby is fully born. However, the birth process is not yet complete. The umbilical cord still connects the baby to the placenta inside the uterus. The placenta is the organ that supported the baby throughout pregnancy, supplying oxygen and nutrients. After the baby is delivered, the uterus continues to contract. These contractions cause the placenta to detach from the uterine wall. Once detached, the placenta moves down through the birth canal and is delivered. This stage is known as the third stage of labor. After the placenta is expelled, the uterus continues to contract firmly. These contractions help compress blood vessels at the placental site and reduce bleeding. Gradually, the uterus begins the process of returning toward its pre-pregnancy size. Labor and birth represent an extraordinary example of coordination within the human body. Hormones initiate the process. Muscles generate powerful contractions. The pelvis provides the pathway, and the baby actively adjusts position to navigate that path. Together, these systems work in harmony to bring new life into the world. If you found this helpful, subscribe for more 3D medical explanations, and keep learning how the human body works from the inside.